as we look at the evolution of attacks, we look at with nostalgia at some of the early types of threat actors that came about when they were authoring things like viruses and worms and rootkits and things like that. So in the early days, back in the mid 90s, around the initial commercialization of the internet, you have, a lot of criminals that are looking online to abuse, very simply, insecure platforms, architectures, etc. And so the basic motives back then was just simply kind of trial and error. See, it was kind of more of a novelty. But that novelty definitely grew over the years. We go into the dot-com era of 2000s into 2005s. And then now you start to see the novelty of interest in hacking to basically evolve into a business model of information compromise, things that relates to like identity theft and credit card theft. Fast forward to today, where are we at? Well, there's some new terms that have definitely been introduced. There's some interesting attacks where we're looking at things like, deep fake technology, which is amazing to be able to replicate the likeness of someone else's voice and image and video and script out something that they actually never said. And I'm sure many of you, if you Google deep fakes and, President Obama and deep fakes and Tom Cruise and a couple other, deep fake videos, the technology is pretty sophisticated. And you can get anyone to say with the likeness of someone, you can get that someone to say things with their same intonation, same physiological expressions. So the common theme as we look at the trend is that there's been a lot of perpetration of trust. There's different interests now as we looked, in the 2012 era, you see a lot of now nation states getting behind the business of cybercrime, trying to undermine elections and economies and corporate entities that have a very global presence. But, from a healthcare perspective, where should you guys really tune into? Well, a lot of these threat actors are still motivated by information. And in the healthcare industry, protected healthcare information is definitely very much has a high level of reward financially, and there's a lot of information that can be leveraged for identity theft and other types of threat motives. But the most important thing to understand here is that a lot of this stuff is fairly easier when attacking the healthcare sector. Now, specifically looking at the healthcare sector, let me bring out some things that were highlighted from, our threat intel team at VerSprite. But, obviously it's been a busy year. There's been a lot of things that have happened, in terms of general hacks and compromises. The exchange compromise definitely has been, affecting a lot of different smaller healthcare providers and entities. We look at things like, for example, there were some trends where, phishing attacks, for example, which has always been a go-to and a fan favorite from cyber criminals worldwide, of basically now targeting, pharmacies and hospitals. And the increase has been, that 189% is not a surprise, based upon what we see from the types of attacks and threats that we defend in terms of healthcare entities. So triple-digit high numbers in terms of an increase, in the past, and this is just the past week. Right? So this is just in the past week. This is recent data. Basically, there's a lot of perpetration. We see, another part here where, let me get out the laser pointer here. We see here that a lot of these threat actors are looking to represent pharma companies, and they're looking to use that level of trust of big entities in order to undermine the trust and confidence of target companies so that they can click on something, they can open up an attachment, and they can simply correspond to them or even have a voice conversation with them. The vaccine rollout that's going on right now, again, this is recent intel. There's a lot of propaganda campaigns that are looking to really target end users, companies that are affiliated with this type of rollout. There's other types of vaccines and rollouts that are being researched. There was some campaigns that relates to International AIDS Vaccine Initiative, where there was a domain compromise of iavi.org that had vulnerable endpoints associated with it, and Microsoft Exchange server vulnerabilities that were left exposed, and that obviously provided a conduit for ransomware attacks. So this particular not-for-profit public-private partnership group was responsible for the acceleration and development of vaccines related to HIV prevention and AIDS. So the theme that we're seeing here with different healthcare-related focus is that there is a lot of initiatives that are happening on the healthcare front that are being abused and leveraged as false pretenses for conducting different types of attack, especially over email, but also over other mediums such as voice-based attacks and in-person perpetration and things like that. Now, this 2021 obviously is a new start to a very difficult year with the pandemic. You know, a lot of companies and individuals are very hopeful that, you know, things will get back to normal. But I think, you know, in reality, many experts and professionals feel that there is still going to be, you know, some time period before the remote workforce goes away, if at all. You know, there's a lot of well-known major brands that have decided that the remote workforce is actually their now common de facto. So what we have here is we have, you know, some trends that we need to be mindful of. Number one is that there is a proliferation to the cloud that is now in hyperdrive. You know, so before the pandemic, the cloud was a hot thing. And by cloud, you know, there's a lot of different things that we mean by that. You know, yes, it does include Amazon and Google Cloud and Azure Cloud, but it also includes service models where you have healthcare providers, maybe like owners of patient portals that have a multi-tenant cloud platform. You know, different platforms where your medical records are now online in the cloud, shared with other, you know, healthcare entities is very much becoming a de facto. So hackers now realize that with a decentralized model, they can set their eyes in trying to attack the end user. You know, here we have a picture of, you know, the classic parent trying to do their job. You know, the son or daughter is on the iPhone trying to, you know, just get distracted without hacking into their parents' MacBook. But, you know, in all seriousness, you know, we look at some other threat pandemics that just extend beyond compromising credentials to the cloud, which is one area of focus by cyber criminals. Another area is, you know, the fact that, you know, healthcare, unlike its financial counterparts, you know, was largely before the pandemic, you still had a lot of instances where you had centralized traditional on-prem environments. But now with the pandemic, they've had to pivot. You know, how do we provide our services from a decentralized architecture where we push things into the cloud, you know, through self-hosting into our own private, you know, cloud environments, or we rely on third-party service providers. Again, the concern here is that you have credentials to get into all these places. And so the pandemic really forced a lot of companies to really go to and further expand their cloud presence. So this puts a lot of emphasis on the endpoint. You know, see, in this example that we see here, you know, we see, you know, consumer electronics, you know, laptops, you have mobile devices, you have printers, you have IoT components that are all on the shared network of now a home office environment. And so the criminals already kind of map this out. They understand that they don't necessarily have to approach maybe the device itself. I mean, sure, they can through phishing and malvertising and drive-by download and other types of attacks, but they could also do it by trying to undermine the corporate home environment. A very popular router brand, for example, or a very popular IoT device like Alexa, you know, or something like that. So the consideration and really this comes down to from an IT management governance and security governance standpoint, being able to understand like what is the new threat landscape of home devices that are neighboring now corporate devices that have protected health information potentially.